The opinions expressed by the host and guests in this show are not necessarily the views of Children's Health Defense.
Good morning, CHD. It is Wednesday, July the 8th, 2026. We're live here at CHD TV. We've got a great show for you today. So in a minute, I'm going to bring on Brian Hooker, and we are going to be talking about the latest CHD science update, including the Andrea Shaw indictment. Then we're going to go to Isabella Yorn, and this is a really good segment as well. This is Twila Brase talking about be very careful. If you're going to have a baby in hospital, be careful what you're signing before you go in. And then we're going to have Dawn Richardson live with her Advocacy Lifeline. And she is going to be talking about the proven strategy to pass medical freedom legislation. Super important. So great show today, but let's get it all kicked off with our Brian Hooker. Good morning, Brian.
Good morning, Polly. Good to see you. How are you doing?
We're supposed to have a little science,
No, it's all good. I was waiting for us to pop up on the little screen, but no, it's all good. Busy times at Children's Health Defense. I mean, there's never an end to the good and the bad. We've actually had one of our papers, a paper that I did earlier in 2020. With Neil Miller, a medical journalist from New Mexico, that has been given a notice of concern. If you pull up or expression of concern, it is under investigation for several different types of concerns, including data integrity, including methodological errors, and including undisclosed conflicts of interest. It's under attack, and many papers like this are under attack right now. The journal contacted me with this ridiculous set of claims, and some of the claims go back as far as things that were raised to me by the journal over a year ago, that I had already addressed. And it seems like there's open season. Neil Miller had another paper out of toxicology reports completely removed. There was a 16-year-old paper by Gallagher and Goodman regarding the hepatitis B shot and special education in boys that was completely retracted. And it's just mind-blowing, the level of censorship that's going on right now. In the case of Neil Miller's paper, they couldn't retract it under their current rules. So they came up with a new term or a new label of removing a paper.
But so, Brian, is this Big Pharma doing it? I mean, who's doing this? Is that these journals are being, I presume, funded by Big Pharma?
Well, a lot of the claims come from a website called PubPeer, which is supposed to be this anonymous site where you can comment on peer-reviewed literature that is listed in PubMed. And what it's become is a forum for probably a handful of people, less than 10 people, who go by multiple pseudonyms, who just come in and bash, appropriate vaccine safety science, whether it's on the COVID vaccine, whether it's on aluminum in vaccines, whether it's on the vaccination schedule. And they will pummel these papers, come up with very, very fraudulent claims, and they can hide behind anonymity. If you look at the background regarding PubPeer, it is funded by individuals that you can tie back to the Gates Foundation. And the PubPeer Foundation looks, smells, tastes like, a pro pharma lobbyist. I did not do the legwork on this, so I don't know if we can tie them directly to any pharmaceutical interest. But gee, it is it's very, very suspicious that this same group of people, if you raise a question on vaccines in the open literature, then they will start to comment and they will start to malign your paper.
Right, well, staying with vaccines, let's go to the headline on with Andrea Shaw. It is about her twins, so breaking mother of twins who died 8 days after vaccination, charged with murder. Now, the whole thing around this is super suspicious. I just want to say before you go into this, Brian, that I know many of our viewers know that I have interviewed around 100 stories worldwide of SIDS deaths, and they all have the same story as Andrea. I mean, it's they vaccinate these children, then their babies get sick or die almost straight away, or up to 1 to 2 weeks later, getting more and more sick as they go along. The story is the same as all of the other stories. So why have we got to this, Brian, with a double charge of murder?
I have no idea. I've looked at we've been given access to the medical records, and I've looked at the indictment. I don't see anything in the medical records that would be consistent with somebody being callous and cavalier regarding the infant's treatment. They were brought in to emergency the day after they received 3 different vaccines. And one, the flu shot, the dad cautioned the practitioner giving the vaccines that he was allergic to the flu shot. And so, but they ended up getting the flu shot anyway. And in addition, there was a call to the pediatrician's office the day before they died, the day before they were discovered dead, saying, there is an issue here. They're sickly. They're still sick. What do I do? And the practice was not able to get them in a timely fashion, and they held off. So, this doesn't seem like somebody who's careless or callous about the treatment of, these 18-month-old toddlers. Also, there's a scientific precedence of twins dying after vaccination and twins dying of SIDS. This has been established. The DPT shot showed clustering of SIDS deaths after vaccination, and the vaccination in general in the Neil Miller paper that was just removed, 75% of all cases occurred, 78.3% of all cases occurred within 7 days of vaccination. 58% of all infant deaths occurred within 58% occurred within 5 days. 3 days of vaccination. In addition, there are studies that show that sleep apnea after vaccination, after the DPT shot, peaks at 7 days post-vaccination. And so when you look at sleep apnea, that's when the infant stops breathing, that there's a gap in, the breaths, and that gap can be, sufficiently long to cause suffocation. It peaks 7 days after vaccination, the episodes of apnea. This has been measured. This has been shown. Cardiac issues, cardiac arrhythmia has been shown to peak after vaccination in infants. And bear in mind, Polly, these infants were born premature. They were born at 29 weeks. It's not a typical case of twins that were carried to a gestational age that was normal. Okay, so there's a lot of things that are really, really wrong with their medical history to say, oh, they were perfectly normal and then they died. No, they were vaccinated. They were not perfectly normal. They were taken to emergency. The pediatrician's office was called and warned. There are so many confounding factors in this case. We just cannot, like the Payette County court, we cannot rush to judgment.
No, we cannot. And it seems an awful coincidence to me that Andrea Shaw, lead plaintiff in the Children's Health Offence case against the American Academy of Pediatrics,
Right.
and now suddenly she's arrested, and suddenly Children's Health Offence is being bashed all over the papers. Doesn't that seem an awful coincidence to you? Because it certainly does to me.
Well, they're awfully brave in entering into that case, into that litigation against the American Academy of Pediatrics. But I really think that it is well founded what happened, and that further investigation needs to be done regarding what happened to these twins in light of vaccination. There are several states in the United States that when an infant dies, they require that the immunization schedule that those infants followed be filed as well. Okay, so at least there are some eyes looking at the vaccinations that infants received. I believe in two states, one of them is Louisiana, where these records are required. SIDS does follow vaccination, and it has followed vaccination, and death is a contraindication of many vaccines on the childhood vaccination schedule. So why are we rushing to judgment here?
Right. Okay. Well, more to come on that, viewers. We will keep you completely updated as we know things. We will let you know either through the Defender online or through CHD TV. All right, let's talk about the HPV vaccine. You have an update for us.
I do. There's a very, very strong, statistically significant relationship between uptake of the original Gardasil vaccine. This is data that we have from a legacy data set that we obtained from the Florida Medicaid system. And so we looked at the rollout of Gardasil 4, which was the original vaccine that was approved in 2006, rolled out to the public in 2007. It was rolled out during the period of study between 2007 and 2010, exclusively to women. And so we looked at issues regarding ovarian insufficiency, ovarian dysfunction, any type of female gynecological issue. And we saw very, very compelling results where many of these disorders, they were 5 times more likely after the vaccine in individuals that received the vaccine versus individuals that opted out of the vaccine. So this needs to be brought to light. For so many years, victims of the HPV vaccine were gaslighted. They were marginalized. It was chalked up to all in your head or, some type of psychological issue. But we know individuals like Christina Tarsell, who died from the HPV vaccine. So studies like these, this is preliminary data. We are writing up the publication right now, and we will get it on a preprint server as soon as possible. And we will get it in a peer-reviewed journal as soon as possible. But this is the type of information. The thing that really astounds me is this is the type of information that should have been rolled out when the vaccine itself was rolled out. Why has it taken so long and taken somebody independent like CHD, not the CDC who is in charge of post-market surveillance, but us instead, to roll out these results? And they're very, very plain. They're very, very compelling. And all the results are highly statistically significant. So why are we doing this?
Yeah, and so much death from that vaccine. We have a row of trees dedicated to all of the people that we have interviewed that died from the vaccine. Please, people, this is a very injurious vaccine. It is. There's so much death. But anyway, we're now going to move on to Thorson. Remind everyone who Thorson is, please, and what you've got.
Poul Thorson was one of the authors of the fraud of the CDC regarding vaccines and autism. He was charged with embezzling and money laundering $1 million of CDC grant funds. The federal charges came out in 2011. He fled to Denmark. He was finally extradited to the United States after he was held in custody in Germany starting in 2025. He was very, very recently extradited to the U.S. He's awaiting trial. We now have documents that showed that the person who undersigned at least one of his grants was his lover at the time and supervisor at the CDC, Diana Schendel. I'm waiting for these documents to surface. I believe that they're very, very compelling. I believe that the evidence is very, very clear that there was some type of collusion between Diana Schendel and Paul Thorson to defraud the government, to steal this money. And so I'm right now, I am looking at these particular documents, but I wanted at least to give a teaser. There was an awfully tight relationship here, and Diana Schendel runs free. She has just been given a major award regarding autism research at Drexel University. She holds a joint appointment between Drexel University and Aarhus University in Denmark, who harbored Thorson for a very, very long time. That's where Thorson did his fraudulent research. And so this needs to be investigated right away. I believe that Schendel should be brought in and interrogated at a minimum. I know that there was talk about unindicted co-conspirators, but this is not the type of person that should be doing autism research in the United States.
No, Brian, thank you for your research on that. And I know that you're going to keep digging. You're not going to let this go. So I appreciate you and the Science Department at Children's Health Defence and everything you're doing. Thank you for being on this morning.
All right. Thank you so much, Polly.
All right. Now we're going to go to Isabella Yon with Mothers to Be.
Good morning, CHD TV. This is Bella Yon. Welcome to our Mothers to Be segment, where we chat all things preconception, pregnancy, birth, postpartum, and that precious first year of life. I'm joined today with the lovely Twila Brase from Citizens Council for Health Freedom, and we're going to be learning a lot of crucial information. So listen up. I'm really excited to chat with her. Twila, welcome to Mothers to Be. Thank you so much for being here.
I'm glad to be here. I'm glad to talk about things that mothers care about.
I love it. For viewers who may not know you or be familiar with your work, do you mind just quickly introducing yourself and telling us about the very important work that you do?
Sure. So I am, by training, I am a registered nurse and spent a lot of time and years as a pediatric emergency room nurse, and then went into the school system for several years before I started this organization. And so this organization, Citizens Council for Health Freedom, I am the president and the co-founder, and we've been around for, we're about to go into our 29th birthday or anniversary, and so have been doing this work on policy and trying to protect patients and doctor freedom in and outside of the exam room. And so that's sort of the short way of saying my history.
Amazing. And what first led you into this field and this line of work?
Well, actually, it was just when the Clintons decided that they were going to give all of us managed care and start a national healthcare system run by the government. And being a nurse, I just knew that if the government took over healthcare, they would take over lots of our freedoms around the country, because healthcare sort of covers so many things. And so that was the beginning.
Amazing. Okay, well, let's dive straight into it. Let's start with hospitals, because a lot of mamas, especially all of our expecting mamas, may find themselves at a hospital giving birth or for some other reason. What do parents really need to know before signing any sort of intake form or digital consent form when it comes to being in a hospital?
Well, I think I'll use this question to just sort of cover the hospital and the clinic, since they are kind of similar. So I guess what I would say is it depends on why you went to the hospital, why you went to the clinic, but some of the forms are going to be pretty standard. And so there are standard forms that ask you for your consent, but you should really carefully look at those consent forms, because they might be much more comprehensive than you understand. Some parents and some patients are just concerned even about the consent to treatment part of the form, particularly if it doesn't say that you have a right to refuse treatment. Because if all it says is that I give my consent to any treatment, that the doctor wants to provide, well, then you've given carte blanche consent to all sorts of things that could be coming in the future that you don't know about. So that's just one very basic thing when it has to do with consent. But I have seen consent forms that have 23 or 27 different items and only one signature. Well, what a lot of people think is that there's no need to even read this, because they're there for treatment and the hospital has everything, or the clinic has everything in mind for their good, and so they don't even bother. but they really should bother, because you would be amazed at some of the things that you will see in consent forms. And so we call those coercive or consolidated consent forms, or bundled, where they have all of these items and only one signature. So I really encourage people to read the consent form and to cross out the things that you refuse to consent to. Put your initials and the date and the word refuse or no consent. And if they say that you have to sign this at the bottom with that one signature, you can always say, I am signing this under duress. Against my consent, I am signing this. And so, speaking as a nurse, having taken care of lots and lots of patients, the exam room, the emergency room, the hospital, it should not be a battleground for the patients. It's supposed to be a sanctuary, a safe place where their best interest is in mind. One of the things I like to say about the world and healthcare today is that the mission of medicine has been taken over by the business of healthcare. And almost every patient and parent can feel that, because everything is about, dotting the I's and crossing the T's and giving the insurance card and making sure that this and that are part of what you are required to do and you fill out. And so you feel, because you're in a vulnerable position as a patient or as a parent, you feel like you have to do it because the care that you need, you can't get. But I'm here to tell you that you can stand up and say that these are the things that I'm not comfortable signing. These are the things I'm not comfortable consenting to, and just, take a stand.
Yeah, I love that. So let's talk about birth specifically. What can a mum actually legally refuse or request before walking to a hospital to give birth, or with these things? Can we decline it all? Can we refuse it all? Or is it only certain things if we actually want care?
Well, really, in the broader scheme of things, a patient is supposed to, and a parent is supposed to be able to refuse absolutely anything that they're not comfortable with or don't want to do. Now, sometimes in different hospitals and different situations, if you don't consent to certain things, you might find child protection called. You might experience pressure from the doctor, pressure from the nurse, or even, sideways glances, or, critical words sent back to you. So some of the things that a expectant mother or a mother, preparing to deliver, she's in labor, or the father might face, are things like, well, really, it's going to happen mostly right after the birth. The things that you should really think about are the birth certificate. You should think about the procedures, such as the hepatitis B shot, the vitamin K shot, and the eye drops. And you have a right to say no to those sorts of things. But for most of the time, you might not even be asked. They will take your baby. So this is a really important thing. Never let them take your baby.
Yeah.
Always stay with your baby. Always have the baby stay with you. And if you're taking a shower, wait until there's somebody in the room who can stay with your baby. So let's just talk about even newborn screening. So this is something that moms and dads often aren't aware even happens. They'll take the baby, and the baby will come back with a bandage on his or her heel. And what they have done is they have pricked the bottom of the heel. They have squeezed drops of blood onto a special card with special filter paper. And then this card they send into the state government for the government to do newborn screening. Well, this is actually government genetic testing of the child. Most parents don't realize that. But importantly, parents don't realize that in some states, the state government is keeping the blood of the child, and therefore keeping the DNA of these newborn citizens at birth, when they couldn't even take the DNA of adults unless they were criminals.
Wow.
And so I remember the story of one woman who knew all about the newborn screening and what we call the baby DNA warehousing, so the warehousing of the child's DNA. And she had determined to stay with her child and never let the child out of her sight, and she decided to go to the bathroom. And she starts to hear her child scream in the bassinet out there. And she comes out, and the nurse has the card, the baby DNA card, where they collect the blood, in her hand, and the needle in the other hand. And the mom just came and she snatched the card out of the nurse's hand and said, "Yeah, you're not doing that to my baby." And so, that's how bold a parent can be. But we're not opposed to newborn screening. It's just maybe you want to do it with a private entity, or maybe you want to find out if there are opt-out forms in your state, or the ability for you to say, you can't keep my card, you have to destroy it after the screening is done.
Wow, I had no idea about that, and no idea that you could even do it privately too if you still wanted to find this information but didn't want the DNA to be kept. So thank you for sharing about that. That is
well, and I think it's even important to know that the government has now funded, the federal government has funded a $14.4 million newborn sequencing project. So in 6 states and Puerto Rico. And they are going to ask parents if they will sequence their child, which means a full DNA genomic screen of the child, so that it will lay out before the child is even 3 days old. They will have had their entire genome sequenced and laid out in a government record, laid out in their private record, and they will not have any genetic privacy, And so they're going to ask parents. And part of this is a study to find out, why do parents say no, and how can we get them to say yes? And so this is a really important thing. They are going to ask consent for it. Most of the times they don't ask consent for newborn screening. It's just considered standard operating procedures, even though it's genetic testing. But this new sequencing trial, they will ask for consent. But the degree to which they will tell parents what this means, like, your child won't have genetic privacy into the entirety of their life after we do this, right? Or what does it mean with false positives? We'll tell you that there's something wrong with your child. It's going to happen more likely because we're going to sequence the entire genome. And then you're going to get this scary phone call, and you're going to hear there might be something wrong with your child. Bring your child in. Studies have shown that the impact of this phone call is very detrimental and can actually go further into the child's life, because the parents, even though they come in and they find out that nothing is wrong with their child, there's still a piece of them that thinks that the first test was right and the second test was wrong. And that has been called the collateral damage of newborn screening.
Wow. Gosh, so insightful. Thank you so much for sharing all your wisdom here. I know we don't have all the time in the world, but I really did want to also touch on HIPAA. What are the biggest misconceptions that we have about HIPAA and medical records? And does it actually protect us, or is there something else that we might need to know?
Yeah, so HIPAA took away privacy. That's an interesting thing, a deception that most people have bought into. But the fact of the matter is that HIPAA gave our medical record data to a cast and crew of outsiders without our consent. And so when you're at the doctor's office and there's some statement in that consent form, so you're reading down, right, a consent form, or on the iPad, and it goes something like this: I have read or received or understood the notice of privacy practices. By law, HHS says you do not have to sign that. That is all part of the deception to make you think that HIPAA protects your privacy. And HIPAA, according to the federal government, there's the potential of 2.2 million entities who could have access to your data. Some of it de-identified, some of it completely identified, address, name, and everything, all without your consent because of HIPAA. And then the mandate that every doctor use a government certified electronic health record, and that all of your data is digitized, has made the sharing of your information easy, very, very easy. And so there are state health information exchanges that the electronic health records are connected to. There's an e-health exchange, which is a national health information exchange, where, let's just say you're in Washington and you get hurt and you don't understand, why does the doctor know all the medications that I'm taking in Virginia? Well, perhaps he's tapped in to the e-health exchange and he can see all of your data without your consent.
It's crazy. do you have any insight into why they're doing this? Why do they want our data so much?
Well, I would say that there's a variety of reasons. I'll give you just a few. One of them is just the money. Actually, a medical record has more value on the street than a social security number, but it also has enormous value for those who want to extract the data, profile the patients, control the doctors, ration care by coming up with research studies that show that X, Y, and Z are not good for you, even though they might be. But if they can have a study that shows it isn't, then they can say you can't have it because it's not medically necessary. United Health Group, the largest health plan in the country and in the world, they have a data group. It's called Optum Insights. And I think it was in 2023 where their revenue was $18.9 billion. And all they do is data, slice and dice, research, reports, sell, all of that sort of thing.
Gosh, it's a whole nother world of information and mind-blowing, honestly, for hearing this the first time. I know you are a big advocate for informed consent also, and many mums, I think, struggle with finding a doctor who truly listens and respects parental involvement and decisions from parents. Do you have any advice for mums who might be searching for, a practitioner or a doctor that listens? Where can they find these people? Do they exist?
They do exist. And so we actually have a directory of some of them. It's called the Wedge of Health Freedom at jointhewedge.com. There's about 550 physicians and other practices around the country, including about 4 pharmacies, I think. And it's all cash-based. And so really where you're going to get a doctor who works for you is not through insurance, not through government programs, but it's somebody who you pay cash to. So an independent cash-based direct pay doctor, cash check or charge. And so we have it at jointhewedge.com. But if you're in a state where you can't find one of those practices, I would just say Google, do a search for private doctor, cash pay, independent, or you can also look for direct primary care or DPC doctor. They also take only cash. And so you can do that kind of a hunt. If we don't have them on our network, you might just be able to find them with a Google search. But you will find that even on our network, we're a freedom organization. We're protecting patient and doctor freedom, but we haven't made that stipulation for doctors and practices on the Wedge. We have just said that they have to be cash-based and they have to protect the privacy of your records, and they can't do government, they can't do insurance, and they can accept any patient from anywhere. So whether you're Medicaid, Medicare, whatever, you could go find a doctor who works for you. But they still might push vaccines. And so, like I said, it's just, you have to find a doctor that has your values. If vaccination or, multiple vaccinations very soon in the child's life is not where you want to go, it's a good thing to just call up the practice and see how strongly they push vaccines, even though they're not getting paid by an insurer or the government.
Sure. Gosh, thank you so much for that. And you spoke a bit about your network. How can mums get plugged into the work that you do and learn more about all the information that you've shared here today?
Yeah, so they can go to cchfreedom.org, cchfreedom.org. They can also, buy my book. It's called Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. And I know it's on Amazon, but I know you can find it anywhere where books are sold. So it's gotten 8 awards, and people have said it's the best history they've ever heard about how we lost our privacy and control in this country through the loss of control over our own data. Oh, I guess the one thing that I haven't mentioned is the birth certificate worksheet. So only fill out the very basics of information, not all of your family history, your education history, your finance, and everything else that they're going to ask you for, because they're just gathering data on you at the state level, and don't let them do that to you.
Wow. Okay. So just to clarify, you don't have to fill out all of that and you can still get a birth certificate?
Absolutely. There's only a certain number of things that you have to have as a birth certificate, the names of the parents, the address, the sex of the child, but all of those things about your income and about your education and about behaviors and all of those things, those are not necessary. And we did a report on birth certificates. It's still one of our most popular reports. And we just looked at what well, I think it was 27 different states that we looked at their birth certificate worksheets and just talked about all of this data that they were trying to get on the family right from the get-go. And you don't have to do it.
Wow. Twila, we always end our segment with one question, and that is, if you have one piece of advice for an expecting mama or a mama to be, what would it be?
Well, I would absolutely tell them to get our one-pager. It's called Protect Your Child, Protect Your Family. And what we do in there is we have got about 10 different things that they should think of when they go to the exam room or when they're in the hospital. And one thing I didn't mention with you already is just when you're in there with your it's not an expectant baby, but you might have another child, right? An older child. And they're going to try to kick you out of the exam room. And you absolutely should not ever let your child alone in the exam room. Just like I said, don't let your child alone in the hospital. So just get that, your Protect Your Child, Protect Your Family, and it's right on top of our website in the little rolling pictures. And so cchfreedom.org is where they can find that one pager.
Gosh, well, thank you again so much for sharing all this with us. And mamas, make sure you check out that website and that book to learn more, just such crucial information that we're guarded with and armed with so that we can make the best decisions for our family. So thank you so much for joining us today. You've been amazing, and we'll chat soon. Thanks, everyone.
Thanks so much.
Hello, my name is Dawn Richardson, and welcome to Advocacy Lifeline. You're live here on CHD TV. Thank you so much for joining us today. The purpose of this show is to help empower you, our viewers, to use your voice to affect change in law, policy, and public opinion through education and action for issues that are important to you and your family. I want to make sure that you know there's no medical advice being given here and no legal advice. These are my opinions and not necessarily the opinions of the National Vaccine Information Center, where I work full-time as the Director of Advocacy, or for CHD. So today, we are going to be talking about an absolute proven strategy to pass medical freedom legislation that is so simple that literally anybody can share this with their legislators. Now, I need to step back first and set this up so I can explain exactly how you can do this. And I need to tell you about some tools here. So y'all may know, for people who watch this show, that I created and run the National Vaccine Information Center State Advocacy Program. We work with families, health freedom organizations, state legislators, and their staff to oppose and prohibit vaccine mandates and vaccine status discrimination, repeal existing vaccine mandates, challenge mandatory enrollment in electronic vaccine tracking systems, making these systems opt-in instead of forced inclusion or opt-out, and we do so much more. The NVIC Advocacy Portal, where you can find it at nvicadvocacy.org. We launched it in 2010, and we analyzed and tracked thousands and thousands of bills. We give detailed descriptions and summaries at different levels, depending on how much information you want. We track these bills through the legislature every day. We provide action to take as the bills move, and we give position statements that evolve with the bills as they change, so you can have talking points to use with your legislators. You can view any state, or you can view just the bills in your state, or you can view all the bills in the whole U.S. and see all of them all together. Now, for the highest priority bills, we actually issue action alerts that are distributed through email, online portal posts, social media, and through our text program that we have. So one thing about the portal that you may not know, because I know we have a lot of people on here who use this, is that we actually archive every vaccine-related bill in the portal every session at the end of the session and put these bills in the expired section. And I'm showing you a slide of that drop down where I have it circled there. It's going to default to current bills, and all the bills that are going to come up are going to be the bills for this session. But if you just click on that little down arrow and say expired, it shows every single bill that goes all the way back to 2010. Now, there's a lot if you do this for all states, but you can just click on your own state and see every single bill that is there. So this is important information. We're going to put this on hold for a second because you're going to need that, and we'll come back to it shortly. You're going to need this tool. Now, let's talk about the Constitution for a second. The 10th Amendment of the Constitution declares the powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states respectively or to the people. So vaccine policy is not delegated to the U.S. in the Constitution. So that means vaccine laws are state laws. I used to be an engineer and I used to design microprocessors for IBM. And one of the old expressions that engineers used to always use is GIGO, and it stands for garbage in, garbage out. So it's, a phrase used with computers. It's not necessarily the computer's fault. Sometimes it's the humans and the information they're entering. Anybody who's used any of the AI tools lately know your answers are only as good as your prompts that you give it. So this phrase garbage in, garbage out, I like to use it as an image for you to put up against how you talk to, whether or not you talk to your legislators. Right now, I promise you, there are pharma lobbyists, there are medical trade lobbyists that are talking to legislators in your state. And if you don't talk to your legislators, what's going to happen is the only information that they're going to base their decisions off of is going to come from medical trade or pharma or these groups that have profits in mind instead of your health and your freedoms. So you need to talk to your legislators. We can't rely on the courts for medical freedom. Sometimes we get a good decision here, we get a good decision there, but sometimes we get bad decisions, and courts just interpret existing law. They are not supposed to make new law. That's judicial activism. Sometimes they do. But by and large, our best bet is to work in the states to pass legislation. So since January 1st, 2026, we've had over 1,240 vaccine bills that have been filed in the states. Now, if we look at our positions, how they come in terms of, medical freedom, informed consent, we have a little more than half that we support than we oppose. So it's not as good as previous years, but it's still really good. But in terms of, those are the bills filed. In terms of medical freedom actually passing and getting these bills over the finish line, we're not doing well in terms of these results. We're getting a lot of bills filed, but they are not getting passed. So I just want to show you that we had 18 states with bills that actually prohibited vaccine mandates. These were in Arizona, Georgia, Hawaii, Iowa, Idaho, Indiana, Kansas, Louisiana, Massachusetts, Minnesota, Missouri, New York, Oklahoma, Pennsylvania, South Carolina, Tennessee, Vermont, and West Virginia. You want to know how many of those were signed into law? Zero, none. We also had 22 states with bills prohibiting vaccine status discrimination, and these were in Alabama, Arizona, Georgia, Hawaii, Iowa, Idaho, Illinois, Indiana, Kansas, Louisiana, Massachusetts, Michigan, Minnesota, Missouri, New Hampshire, New York, Ohio, Oklahoma, Pennsylvania, South Carolina, Vermont, and Washington. All right, I can give you a wild guess. How many of those were signed into law? Zero again. So Arizona actually had a chance with the legislature passing two decent bills to end government vaccine mandates and also to end regular vaccine mandates and vaccine status discrimination. But Katie Hobbs vetoed them. The first bill I want to mention that the legislature did pass but was vetoed was House Bill 2248. And this bill prohibited governments, businesses, schools, or ticket issuers from barring employment, entry, service, or a whole bunch of other things listed in the bill based on a person receiving or using a medical intervention. So that would include a vaccine. The legislature passed this bill and the governor vetoed it. So that's just terrible. And then the second bill that was passed by the legislature, House Bill 2086, it prohibits a government entity from requiring an Arizona resident to receive a vaccine for any disease or virus or to wear a face mask. Again, it was vetoed by Governor Katie Hobbs just last month on the 19th of June. You know, it takes a lot of work to get a bill passed, a lot of collaboration, a lot of talking with the legislators. They talk amongst themselves they take testimony, they go through committee. And when you have something this good, these good medical freedom bills passing, only to have Governor Katie Hobbs veto them, I think the residents in Arizona need to take that into consideration and look at, there's elections coming up, and, they may want to consider some of these other options for governor, because the governor doesn't have a lot of power, but when they can veto a bill that people have worked really hard to get passed, that's something that you want somebody in there that has a philosophy on health, medical freedom, medical privacy that aligns with yours. So, if you get a better candidate out there, go help them. So anyway, it's obvious looking at 2026 that the current strategies for these bills are not working. Now, it worked in Arizona to a point, but they didn't have somebody good in place. But the other bills, they just were not getting the movement that we were hoping for. So what I'd like to do today is to propose an additional alternate strategy going into 2027 that has proven success. So let me explain and set this up for you. During the COVID era, where we had so many different restrictions on us, more than half of the states passed legislation prohibiting vaccine passports, vaccine mandates, or vaccine status discrimination that were very much narrowly tailored to just COVID vaccines. So this is what I'm going to call a vehicle for upcoming bills that we want to work on and we want to get filed. So these bills were all passed, from 2021 to 2020 through 2023, 2024. These were when the bulk of these bills were passed. So more than half the states have passed these bills. Now, in addition to having legislators file model type comprehensive medical freedom bills like we've been doing, give them an alternate to file a bill to go into what already passed during COVID and literally just remove COVID-19 or coronavirus from anywhere it mentions a COVID-19 vaccine. So then all the protections, when these bills pass, that these protections that the legislators already approved, it will apply to all vaccines, not just to COVID-19. We still want to file these comprehensive medical freedom bills so that we can have the conversations, we can address things like vaccine tracking, we can address things like, employer mandates beyond what was already discussed during COVID, and so many other aspects with these bills are phenomenal. We still want to pass them so we can have those hearings, we can have those conversations. But what that does is it provides a backdrop to this strategy. What's also really great about this strategy is legislators are looking at old language that they passed, and it's all associated with COVID. And they're remembering what happened during COVID, and they're associating medical freedom and prohibiting mandates with COVID. So when they're thinking about, hey, what's coming? What's the next emergency that's going to be declared? They're more in a mindset of wanting to stop any kind of lockdowns, forced vaccination, and these types of things for any vaccine targeted disease, not just for coronavirus or COVID. So it's a really great starting point, but still file the big bills, still file that, because you never know, we could have something happen. But here's an alternative. So this is what worked actually worked for Idaho back in 2025. That was the last time a medical freedom bill of this magnitude was passed. Nothing passed in 2026. This is the only bill to have passed to prohibit medical mandates, which includes prohibiting vaccine mandates and vaccine status discrimination for all vaccines. Senate Bill 1210 was signed by Governor Brad Little on April 4th, 2025, and it went into effect on July 1st, 2025. The strategy with this particular bill was to go into existing code prohibiting coronavirus vaccine mandates and vaccine status discrimination and substituting the words medical intervention so the prohibition would apply to everything. Now, I'm going to show you how simple this is. So we've got section 4 on page 2 of the bill, and this is, you'll see, this is a very short bill. It's only, with the actual language of the bill, a little more than 2.5 pages or so. And then there's the preamble stuff and all that. But everything changed because they got rid of this reference to COVID. You can see they struck out the word coronavirus and then they put in medical mandates. The enacted version of this bill, which passed in 2025, prohibits any business entity doing business in the state, any ticket issuer, any school operating in the state, and any state, county, or local government entity or official in Idaho from requiring any person to receive or use a medical intervention as a condition of service, admission, employment, access, school attendance, employment, or campus access, receipt of government benefit, services, license or permit, building access, transportation access, or term of employment, with exceptions for the existing laws that were in place for like daycare and school mandates. But they still had the exemptions there. So that's all the bill did. You can see the strikeouts right down, and you can scroll through and see the strikeouts of coronavirus and then the insertion of the medical mandates. This bill also prohibited a person from being excluded under any circumstances in the event of a disease outbreak due to that person's vaccination status. Brilliant. So the legislators in Idaho, in 2025, they went back and they looked at what had already been passed for COVID. And then the advocates came in and talked about how we need to prevent this from ever happening again. Let's open up this language and make it apply everywhere. And that's exactly what they did. This was more appealing than going in and writing a whole medical freedom bill from scratch. And the legislators were able to relate to this because they all lived through COVID and they could see the writing on the wall that this is probably going to happen again. So it was a great strategy. Let's look at another state. Let's look at Florida. And now they haven't passed anything. They tried to pass a bill that would expand exemptions this session, and even that didn't get across. But I want us to look at the laws in Florida that were passed during COVID and the possibility of people in Florida utilizing this strategy. Now, if any of you, I just want to give the disclosure here, if any of you are in Florida and you have a legislator that wants to do something, reach out to me, because I had an elected official in Florida ask me to write a comprehensive medical freedom bill that includes this strategy of going into the laws that were passed during COVID and revamping them to apply to everything. So just, go ahead and reach out, contact us, and you can get through to me and let me know, and we can connect, and I can get you language. I can help you talk to your legislators. I really would like to see Florida do this. And also I'd like to see Texas next session do this as well. Now, there are some states like Texas, Montana, Nevada, and I think there's one more. I can't remember the other one. There's 4 states, and they don't meet every year. They meet every other year. So here's our chance to do this in some of these other states as well. But let's look at Florida and the possibility for a change like this in their laws. We can confirm that Florida already has laws in place that prohibit vaccine mandates and vaccine status discrimination for COVID-19 vaccines, emergency use authorization vaccines, and messenger ribonucleic acid mRNA biologics. It would be a great strategy to amend these current laws to apply to all vaccines. What's absolutely incredible for Floridians is that in existing law, with these very specific prohibitions on COVID era medications and vaccines, the legislative intent that's specified in section 381.00316 of Florida Code is very broad and already states that's the intent of the legislature that Floridians be free from mandated facial coverings, mandates of any kind related to vaccines as provided in this section, and discrimination based on such vaccination status. Also, it says that society is harmed by discrimination based on vaccination status as provided in this section when healthy persons are prevented from participating in society and accessing employment opportunities. And finally, it also says that remedies to prevent such discrimination are in the best interest of the state. Now, legislative findings are things that legislators put, they're statements that legislators put in the beginning of a bill to kind of set things up for context and intent of the bill. And they show where the mindset of the legislature is when they're crafting this law. So even though the legislature only applied the prohibitions for vaccine mandates and vaccine status discrimination to COVID-19, EUA, and mRNA vaccines, the legislative intent of the law doesn't have any of these qualifying restrictions. And the language of the previously passed COVID-era restrictions is very easily amended to expand these prohibitions to include all vaccines. You guys in Florida, you have it. It's all set up for you. The legislature already had passed a bill with the intent to stop this for all vaccines, but it has not yet been done. So this is a great starting point. So now what about if you're in another state? You're not in Idaho or Florida and you don't know what you're going to do. So here's how you're going to figure out if you have an option in your state. Earlier in the show, I showed you how to go into the NVIC advocacy portal at nvicadvocacy.org and look up vaccine bills from previous sessions. If you go to your state page on the portal and look at the expired bills from previous sections, you can do a search in the search tab for the word enacted, and it's going to just bring up all the bills that were actually passed. And you can look from like 2021 through 2024, 2025, and look at the ones that were passed into law that prohibited COVID vaccine mandates or vaccine status discrimination over mRNA or COVID vaccines. Go into those bill posts and look at them. You can click, there's full descriptions on what they do, but you can also click on the actual state law and you can look at it and you can see how this strategy will work. So here's the thing about legislators, guys. They want to help you most of the time. If you talk to a legislator and you present a problem, it's really hard for them sometimes to figure out, well, what am I going to do to fix this? If you go to them and say, we can amend this area in law that took care of prohibiting COVID mandates and COVID vaccine mandates and COVID vaccine discrimination, and we can take out the qualifier COVID and just have it apply across the board, they can wrap their arms around that and they can see that they could have a bill filed that could actually expand medical freedom and choice and informed consent in their state. And it's an easier sell for them when they're advocating either in front of a committee or on the floor because they're talking about language that has already been passed in response to real restrictions everybody lived through. They're going to remember this, and we're going to talk about they can talk about upcoming diseases and how we need to be prepared and to prevent that stuff from ever happening again. We don't want families not being able to be fed because, the workers in the family, the employers have fired them over a vaccine mandate. Things are crazy. Look at even in the military with Pete Hegseth going out and saying we're not going to do any more vaccine mandates, and then in San Antonio there's a couple of flu cases. There's a handful of flu cases or whatever, and now they're back to the mandates. It's so easy for society to slip back into this type of a mandate, no choice mentality. So we need the laws in place now as protection. And this is your vehicle for change, going back into the COVID era protections that were already passed and changing them to apply to everything. I think you're going to find that legislators are going to be more responsive to this, as it's already proven in the state of Idaho that was their strategy, than doing a complete comprehensive medical freedom bill. Again, still file those, still advocate for those fantastic bills. I just think that you're going to get more response, or that this strategy of going into the COVID era prohibitions and expanding them might open the door for more conversations on the comprehensive medical freedom bills as well. The strategy worked for Idaho. It may work for your state too. So I wanted to share that with you and get that out, because this is the time to be talking to your legislators. A lot of states are either their sessions are done or they are in recess. And this is the time when legislators are going to be open to new ideas and can wrap their brains around, doing this, taking this on as a priority in 2027. So in closing today, talk to your legislators about going into these previously passed laws and filing bills to amend these laws to apply to all vaccines, not just to COVID-19 vaccines. Please share this episode with others. Anybody can share these ideas with their state legislators so they can file bills in their states to put some of these protections in their state as well. On the CHD TV website, go under shows and pick Advocacy Lifeline, copy the link to this week's show and share it. I encourage you all to sign up for the NVIC advocacy portal so you can get to this information. You just go to nvicadvocacy.org and sign up, and you'll have access to all this information. It is free. Please commit to taking the simple steps we share with you to make your voices heard with your legislators. This is where you're going to find all these bills that we talked about, and you can do this research. So not only just what's current, but using history to help you move forward. Please also consider donations to CHD and NVIC so we can keep up this important work of bringing you information that you do not see anywhere else, really. So I want to give a special thanks to all of you listeners for our show today. I'm thankful for each and every one of you. We're going to be back 2 weeks from today on Wednesday morning, July 22nd, 10:30 Eastern Time, 9:30 Central Time, 7:30 Pacific Time. God bless you all. God bless America, and we'll see you soon. Bye-bye.
Oh, okay. Okay, we're live. Can you tell everyone your name?
It's Melissa.
Okay, Melissa. This is about your daughter. Ariel. And she was born in
1989.
1989. It's really important that we document these stories from back then, if you like, because this has been going on a long time. If you're new to this movement, a long time. Talk us through what happened. She was your second child, correct?
Correct.
And did you know anything about vaccines when you were pregnant with her?
I just knew that we were supposed to take our kids to the pediatrician to get vaccinated.
Okay, and so how was she when she was born?
Perfect. She met her milestone, started to smile.
And you delayed a little bit the 2-month vaccine.
I was just late. I
Didn't do it on purpose.
didn't do it on purpose, no.
And so she went in, and do you remember what she had?
I don't remember exactly all of them. And I could probably find out, but since learning about what really happened, I've done research, and I believe it was the DTaP.
Or maybe DPT, I don't know what was there then. So what happened? She took her vaccines then, and then what happened?
Her appointment was on a Friday. Took her in. The doctor said that she might be lethargic and might be in some pain. Can give her Tylenol. Listened to the doctor. I did what was expected of me. My husband and I at the time were living with my mother-in-law, and I wasn't working, so I was taking care of Ariel and my son Adam. And the following Tuesday, I woke up to my mother-in-law screaming, "Dennis, Melissa, the baby's dead." I had to run into the baby's room, and I just saw her lifeless body. I was very young. I didn't understand all of it. When the autopsy came, I read through it, not understanding any of it, because I wanted answers, because there was nothing wrong with her. Child after her, and the doctors said because she died from sudden infant death syndrome that he needed to be put on an apnea monitor to watch his breathing. That was another nightmare. Just waiting for that monitor to go off. I think it was sadistic, if you ask me, but I didn't understand that vaccines were the cause of her death until 2019. Thank God for social media in some ways, because I was somehow introduced to Katie Klobes, Karen Kane, all these people who have similar stories that have lost their children or suffered, had irreversible damage because of their well visits.
Oh, wow. I'm sorry. I was so sorry. She would have been 34 today? Yeah. Thank you for telling her story. I really appreciate it.
I just want other parents to realize that when they go into the doctor's office, they have the right to ask for those inserts.
Or maybe don't go to the doctor's office unless you're sick. Why take a healthy baby?
This is true. There's no need for it.
No need for those health checks, people. This is not necessarily the views of Children's Health Defence, but most definitely the views of the people sitting here right now. Okay. Big love, everyone. We still have more stories.
This and all CHD TV programming is made possible by generous support from viewers like you. Please consider making a contribution today to keep our programming going strong. Thank you.